back everyone to Einstein's Eyes, where we talk about interesting topics in ophthalmology and other areas of healthcare and medicine. Uh, we are going to explore how arthritis affects the eye. And this topic affects millions around the world. Whether you're someone dealing with arthritis or just interested in the links between systemic diseases and ocular health, hopefully this episode will have something for you. So let's dive in. I'm Carl Rosen, oculoplastics, formerly neuro-ophthalmology in Anchorage, Alaska. My co-host and friend, Jon Didkoff, where we met each other many years ago in the Cretaceous period at Albert Einstein College of Medicine. Jon?
Hey, y'all. So I'm Jon Didkoff. I'm a general ophthalmologist specializing in cornea and anterior segment, which is exactly what we're going to be talking about, the front of the eye today. And I've been in practice for about 30 years in New Jersey, and it's always nice to see Carl at the other side of the country, in Alaska.
Right. Thanks, Jon. So let's talk about arthritis. Now, most people think about joint disease, pain, stiffness, swelling of the joints. But what many people don't know is that arthritis can have significant effects beyond the joints, including on the eyes, the visual system. In fact, some types of arthritis can lead to serious eye conditions that really require careful management and ophthalmologic care, and that's where Jon and I come in. But let's first talk about the demographics of arthritis. Arthritis is a global concern. It really affects over 350 million people worldwide. The most common types are rheumatoid arthritis, which is the autoimmune type that we'll really focus on today, osteoarthritis, which is more degenerative, but there are other forms, including juvenile arthritis, which affects younger folks, and psoriatic arthritis, which is associated with psoriasis or skin diseases. And they all have unique impacts on the eyes. As I mentioned, focus more on rheumatoid arthritis. So let's break it down. So rheumatoid arthritis affects about 1% of the global population and often starts in early adulthood, with women being more likely to develop the disease. As many of you know, rheumatoid arthritis is an autoimmune condition where the immune system attacks the joints, attacks the body's own systems, and the inflammation can really cause big problems, but it can also affect the eye. And one of the most common eye conditions associated with rheumatoid arthritis is something called scleritis. And I'm going to show a picture of that right now. Here's a picture of scleritis, and you'll notice that the sclera, which is typically white, is very red. And we call this granulomatous because it has a dark violaceous hue. The surface vessels are dilated and very prominent. And this is painful and just not fun.
That's a great overview. I think in terms of this eye we're going to talk about, I think I would just add a couple of things. So the way I look at arthritis, and by the way, there's also juvenile rheumatoid arthritis, which we're not going to get into, but that is also autoimmune and has its own set of things. One interesting thing about juvenile arthritis, I'll just mention, is that children can have basically inflammation in their eye unbeknownst to them. So they can have a white, quiet eye. And when they go to the eye doctor, we can see the inflammation, we can see damage related to it. So it's very important for anyone out there that has JRA to go in for screening eye exams with your doctor. Now, on the other hand, adult arthritis, if it's going to affect the eyes, Carl nailed it. I mean, basically, the autoimmune type is what we're going to talk about, which is the rheumatoid arthritis. And the way we look at autoimmune diseases, in the eye is vascular. It has blood vessels that supply oxygen and everything else. So any part of the body that has oxygen or blood being supplied there can be affected by autoimmune disease because the autoimmune antibodies circulate and they can attack. So basically, the way we look at it is anyone that has this underlying condition is also at risk for inflammation in their eye. And they can get inflammation in the front of the eye, such as here where you can get episcleritis, or this is actually more serious, scleritis. Scleritis can be very dangerous. I mean, it's very painful in most people. It's inflamed, it's red, and untreated, you can get what's called a scleral melt, where the wall of the eye can actually thin out so much that you can actually lose the eye. So if you're out there and you have inflammation like this in your eye, you need to seek medical attention, and it gets a little tricky. So in this kind of patient, I might start them on anti-inflammatories. I might start them on something very conservative. And if that doesn't work, I might go to steroids. But while I'm doing that, I'm going to want to know, hey, do you already have a systemic condition? Some patients come in like this and they don't even know they have any medical condition. So I send them for a full workup and we find out they have rheumatoid arthritis. And at that point, they really need systemic treatment. And that systemic treatment might be initially steroids. We have a video about steroids and the risks. But as soon as possible, we like to wean off the steroids and get them on some type of systemic therapy. So we're not going to get too deep about the different treatments. Suffice it to say that the inflammation in the body is causing inflammation in the eye. So it's the eye doctor's role here to work along with the rheumatologist or the medical doctor and do basically a team approach to controlling the inflammation in the person's body and therefore their eye. A milder case here might just be episcleritis, where they get redness, but it's not in the deep part of the eye. That's something you don't really need systemic treatment. You can get away with eye drops usually. You might even get away just with anti-inflammatory like aspirin-like eye drops. We call it ketorolac, or other ones like Voltaren. And what they do is they decrease the inflammation like aspirin does. And you might even just give the person oral aspirin, like aspirin, Motrin, Aleve, any of those anti-inflammatories, and that might work. But now when you get deep inflammation like this picture really requires the big guns. So along the same lines, I'll just add the most common thing I see as basically a specialist that deals with the front of the eye is dry eye from arthritis. So a lot of people don't realize that as people develop arthritis, it also gives them a higher risk of dry eye. So I deal with many patients who don't have the serious stuff. They don't have the inflammation. They don't have the uveitis, which is inflammation deep in the eye. But they still get pretty significant dry eye. It could be pretty severe. And again, some of those patients I'm really treating just locally. I'm going to treat them with all the modalities I do as a dry eye specialist. You can watch our video. But again, sometimes they require systemic autoimmune treatment to decrease, immunosuppressive treatment to decrease this inflammation that's going on, not only in their body, but in the eye.
Right. Thank you, John. So just to recap, so rheumatoid arthritis can affect the tear glands that produce tears, and that can lead to dry eye or gritty sensation and irritation to the eyes. And that can lead people to the ophthalmologist or the optometrist. I do want to mention JRA is juvenile rheumatoid arthritis, and roughly 10 to 20% of kids will develop eye problems that have this. And it's notably iritis, different than scleritis. It's iritis, which is in the front part of the eye, just behind the clear part called the cornea. That's a different type of inflammation, but it can be very dangerous. And as John mentioned, we do start with anti-inflammatories, non-steroidals, like Advil, in that category. You bump it up to prednisone-like drugs, corticosteroids, and then you can give immunosuppressive drugs like methotrexate and others. But we typically work with and recruit a rheumatologist or an immunologist that has specialty training to deal with arthritic conditions. I do want to just touch on psoriatic arthritis, which we mentioned, and around 30% of people with psoriasis develop psoriatic arthritis. And this can also cause inflammation in the eye called uveitis, or an inflammation of the uvea, which is the middle layer of the eye. And that can lead to pain, light sensitivity, we call photosensitivity, and blurred vision. And again, if untreated, can lead to long-term damage, including glaucoma and cataracts. Finally, osteoarthritis, which is not typically associated with eye diseases in the same way that rheumatoid arthritis is. It's a degenerative disease without inflammation, but osteoarthritis can cause significant pain or disability, and that can affect the way, your overall health. So we do talk about that as well. John, was there anything else?
Yeah, I think that was great. I mean, the only thing I would just add is that what's interesting for me is many people have been to my office over the years where they didn't know they had a problem. And they came in with either uveitis, which is inflammation like Carl was talking about, inflammation deep inside the eye, or there's more superficial inflammation. Typically, I might not do a full workup right away, but if they have symptoms, I will. But if they feel great, I might treat it. But if it keeps recurring or it becomes more chronic, Then at that point, we get a rheumatologist or their primary care involved to do a full workup. And sometimes we find out they have rheumatoid arthritis or other inflammatory conditions.
Right. And again, I'm just going to touch on this, but there is lab work that you can do, and you can monitor the inflammatory state within the body. This is something called a rheumatoid factor. And perhaps we'll touch on that in a separate video. But so in conclusion, arthritis can affect your ocular health or your eye health. They're closely connected, and understanding that relationship really between the eye and the arthritis can help prevent long-term complications. So we do recruit rheumatologists to help ophthalmologists like us, and that leads just to better overall results and greater success. So thanks. Please share, like, and subscribe, and we will see you on the next one.
See y'all.